So now let's talk about this preterm baby, baby L, and what challenges she has in terms of all this that we've set up in terms of the physiology of heat. There are specific challenges to the small preterm baby and small baby in general, and those include the following. One is that they have a surface area that is different than adults and even older babies, and that impacts on their heat exchange. Their weight itself will alter their ability to manage heat. They have limitations in terms of what they can and cannot do. And in addition, there is a great deal of water loss from the skin, which we need to talk about, and that is variable with gestational age. So when you look at the surface area, for instance, of a baby, just looking at a term baby versus an adult, there's dramatic differences in terms of their surface proportions. And so a baby has much more head than an adult. For an adult, our surface area from our head is only about 7%, and for a baby, it's almost a quarter of their surface area. What does this mean? This means that babies' heads are very important when you're talking about thermoregulation, and that's why we often put a hat on a baby in the delivery room. And actually put a hat on a baby early on. Sometimes even during resuscitation, you care a lot about the heat loss from the head. So the proportions are markedly different. And actually, if you look at their surface area of a baby, their skin surface area for the weight of the baby is much greater. So the baby has much more surface area for their body mass compared to an adult's. And these issues are exacerbated as the babies get even more preterm. And so preterm babies have even larger head proportions than a term baby, which is much larger than an adult. You and I know that we go out in the cold without a hat on and we feel uncomfortable. Think about putting a baby with 3 times really the proportion of head circumference in a cold environment without a hat. That is going to have dramatic impact on their ability to maintain a core temperature. So the low birth weight infant has issues that are very important to consider when warming the baby. They have a large skin surface area, as I mentioned, in relation to their body mass. Much more exposure of skin for their very small bodies than you and I have. In addition, they have a very thin layer of insulation. So some of us have more than others, but babies rarely have a huge amount of fat between the skin and the core, so they don't have a lot of insulation. Just like a coat, they don't have the insulation you and I may have. And the distance between their skin and the core areas, so their heart and the brain and the other organs, is very short. So if the skin cools off, it doesn't take long for the rest of the body to cool off. The core drops quickly. So these really geometric differences in babies really makes a big difference. And finally, they have different organ characteristics. So they don't have glycogen stores to burn. They don't have the brown fat, perhaps when they're preterm, to burn. And these impact greatly on their ability to sustain and adapt to cold. So a preterm baby, for all these reasons, will drop their temperature much more quickly than a term baby. And a term baby will be less able to handle cold than an adult. So when you look at where the neutral thermal zones are, even when you just look at the difference between a preterm infant in pink and a baby who's larger and near term in blue, you'll see a change in the needed temperature to keep them warm in the same humidity over time. So there's change. The 2 points of this slide are that a preterm baby, or a baby who's smaller at 1 kilo, is going to have a lot different temperature needs and in general warmer temperature needs than a larger baby, a 2 kilo baby, even if it's preterm, in blue. And in addition, the second point of the slide is, as the baby ages, because things change, which we'll talk about, the baby's temperature needs will change. So this is a day-to-day change. And impacted by both the weight, gestation, the age of the baby in days from birth, as well as the special characteristics that we've talked about of the baby, their metabolic rate, and their particular environment. So, challenging to manage these babies, but also important to recognize that these babies are different minute to minute, day to day, and so the environment has to be consideration on an ongoing basis.